I'm Phil Brown. I am one of the attending faculty members here. I've been here for 6 years now, which is hard to believe. Here at our clinic in Santa Monica and also in our other clinic in Mid-Valley, we basically see every insurance that is seen in Los Angeles. We take care of every single patient population, those that are literally just born as newborns, all the way to people that are elderly, a lot of people in their 20s, 30s, and 40s, new parents. So pretty much anything you can think of, we're seeing here. So I feel like the why of this program and why it's so important is because I feel like it's really the crown jewel of the Santa Monica area. This is a kind of a hospital and a clinic setting that's providing a lot of care to so many different walks of life. Whether someone is wealthy or someone is homeless, they're getting the same level of care here and they're getting expert level care here. One thing that makes us pretty unique is the fact that we have a lot of different cutting edge technology that we're using here in the clinic, whether it's the fact that we have a new ultrasound, we have a new colposcopy machine. In addition to that, we also are using the newest electronic medical record systems, using Care Connect, using basically the overall is Epic. And having that system makes us really unique because you're able to communicate with the patients in real time. Your nurses are able to message you through the system in real time. So everyone is always on the same page, which I think makes us very, agile in this always changing market of healthcare. So I think one of the things that's super compelling about our program is that whatever you want to do, we can make sure that that happens and that you get that out of our program.
Family medicine in general is a very broad field, covers lots of topics, from women's health to pediatrics to geriatrics. And my goal is to be as well-versed in each of those as I possibly can. The residency program itself really strives to develop physicians who will be comfortable in really any clinical setting once they leave the program.
Throughout the time that I've been here, from the beginning of my residency to now as a faculty, I've seen us develop 3 different tracks. When I started is when the sports medicine track was first starting. And then since that, a lot of residents were very passionate about women's health and wanted to take it to the next level. And so having those 2, and then in addition the global health track, which has just been huge in terms of our ability to give back around the world, is again something that was started here by the residents.
We have lots of kind of after-hours extracurricular small talks hosted by infectious disease experts or East-West medicine experts who basically supplement our education with expertise in different topics that we wouldn't necessarily learn about otherwise. The relationship between faculty and residents is really a very strong strength of this program.
I have many of my attendings' phone numbers saved in my phone, and I can regularly reach out to them if I'm trying to follow up lab results or if I just have a clinical question. And I really just feel comfortable with them, and they can help me learn at really any point of my residency so far.
I find that we have great support. I think they really care about us. They each come with their own level of expertise, their own diverse backgrounds that offer their own unique perspectives that I think really make the training environment here very special.
I think honestly the diversity that we have within our residency and our staff and faculty is truly awesome for a couple different reasons. One, it makes it super inclusive for the residents because they know that whoever looks like them is also the ones that are teaching them, which is really kind of nice, but it also makes an inclusive experience for the patients.
When patients come to us, whether it be in the clinic or in the hospital, they're very often in their most vulnerable state. And the last thing that they want to do is to have any sort of walls that they have to break down, when really what they should be focusing on is their health, their well-being.
I can think of a few different times when I've been in a clinic and I had a patient who didn't speak the same language as I did, and you're able to use translation services, but it's also nice sometimes when you can think of one of your colleagues who that patient might feel more comfortable with next time because they speak their native language.
So when they come to this clinic or they come to our hospital and they find someone who looks like them, who thinks like them, who speaks like them, I think it helps to break down those barriers, not only for that patient, but for the rest of the team as well.
I'm ultimately really glad that I came to UCLA because these people will not just be my colleagues, but my friends for a long time. I have really close relationships with all of our support staff, with our faculty members.
This truly is a family. I know it seems a little bit like a cliche applying to family medicine, but the people here, both the fellow residents, the faculty, the support staff, they really do care about one another. We really care about one another, and it really does feel like a family.
I would be happy to be trapped in an elevator with any of my colleagues at any point, just because we have so many unique people in our program and we have so many chances to work with each other and learn from each other. And I'm just really glad that UCLA actually chose me and I got to be a part of this residency program.